What are the limitations of dialectical behavior therapy? When considering dialectical behavior therapy, or DBT, it's important to understand its limitations, especially in the context of treating post-traumatic stress disorder, or PTSD. While DBT is a well-established treatment originally designed for borderline personality disorder, it has been adapted for PTSD to help with emotional regulation and coping strategies. However, there are several key limitations to keep in mind. First, while DBT for PTSD has shown effectiveness in controlled research trials, its success in real-world settings tends to be lower. Studies suggest that the treatment's effectiveness relies heavily on patient engagement and adherence. This means that in everyday clinical practice, the results may not be as strong as those seen in research environments. Second, DBT is not primarily a trauma processing therapy. Its main focus is on skills like emotional regulation, distress tolerance, and mindfulness. Although it can include some work on trauma narratives, it does not specifically target the core traumatic memories that are central to PTSD. For some individuals, especially those with severe symptoms, DBT alone may not sufficiently address their needs. Another limitation is that DBT may be less effective for individuals with complex PTSD. This type of PTSD involves additional challenges such as interpersonal issues and identity disturbances. Evidence suggests that DBT may not fully address these complexities, particularly for patients who face multiple problems and are often excluded from clinical trials. Additionally, DBT is not typically recommended as the first-line treatment for severe PTSD symptoms. In cases where individuals experience intense symptoms like frequent flashbacks or severe dissociation, other trauma-focused therapies might be prioritized to stabilize these acute issues before introducing DBT. Moreover, DBT requires a high level of commitment from patients. It involves learning and practicing various coping skills over an extended period. Some individuals may struggle to engage consistently or to apply these skills outside of therapy sessions, which can limit the benefits of the treatment. Lastly, effective delivery of DBT requires therapists who are specially trained in its techniques. This can create accessibility challenges in some clinical settings due to resource limitations. In the context of PTSD and safety planning, DBT can be a valuable tool for developing coping strategies, particularly for emotional regulation and distress tolerance. However, it should be integrated thoughtfully with other treatments tailored to the individual's specific symptoms and needs. Consulting healthcare professionals is essential to determine the best approach for each person.